Furosemide is a loop diuretic, a type of water pill. Furosemide is used to relieve swelling from extra foods in children and adults. This medication can also lower blood pressure, though it's not a first choice option for this condition. Furosemide comes as a tablet that's taken by mouth, typically once or twice daily. It's also available as an oral solution for people who have trouble swallowing tablets. Furosemide will cause you to urinate more often as a side effect, so it's best to not take this medication too close to your bedtime.
Next is generic name and patent name of furosemide. Generic name furosemide. Patent names. Furosemide may have various brand names depending on the manufacturer and location. Some examples include Lasix, Furosix, and Low Equa.
Okay, next, here is the picture of each dosage form of furosemide. There are injection, there are tablet, and there are for intravenous or intramuscular use. You can see this is a lot of example. Next, we have drug class and classification. Class and mechanism of the drugs. Medication is loop diuretic and uses is for treats edema and hypertension. Action: increase urine output by blocking sodium and water reabsorption in the kidneys, and specific site of action is thick ascending limb of the loop of Henle. Mechanism of it is inhibit sodium potassium chloride transporter, leading to fluid excretion. Furosemide's effective management of fluid retention make it a crucial drug in treating conditions like heart failure and hypertension. Next,
Indications and contraindications. Indications of furosemide such as edema, congestive heart failure, and hypertension. Furosemide is contraindicated in anuria. Although it can be used in renal insufficiency, in marked increase in blood, urea, nitrogen, or creatinine, or the development of oliguria during therapy of patients with progressive renal disease, is an indication for discontinuation of treatment. Side effect. Common side effects such as urinating more often, dizziness, headache, feeling of belly when you get up suddenly, and skin sensitive to the sun. And other side effect is vomiting, nausea, constipation or diarrhea, stomach cramps, rust, and ringing in the ears.
Now I'm going to talk about pharmacodynamic and pharmacokinetic of furosemide. The absorption rate is, for the absorption, the onset of action time is within the first hour. For the intake in orally, for the peak action time is from the first 1 to 2 hours. For the bioavailability, the absorption is lower than normal in patients with edema and decompensated heart failure. The absorption of furosemide orally is 47% and sublingual rate is 59%. So, urinary excretion rate for furosemide and sodium in the urine excretion is not different between orally and sublingual administration. For the distribution, greater than 95% of furosemide bound to plasma protein, mainly albumin. Only 2.3% to 4.1% of furosemide existent in an unbound form reached to therapeutic concentration. For the next slide, is metabolism. Furosemide glucuronide is a major biotransformation active product of furosemide, having an active diuretic effect. Contemporary evidence indicates that furosemide is mainly metabolized in the liver. For the excretion, the terminal half-life of furosemide is approximately 2 hours, and the total time of therapeutic effect is 6 to 8 hours. So the half-life of furosemide will prolong in the patients with chronic renal disease. Intravenous administration, early and high serum peak concentration, and a higher peak excretion rate. The next slide is dosage and mode of administration. There are several routes for administering furosemide. The first one is oral, and the second one is intravenous. In the oral drug types, there are tablets, capsules, and syrups. For the IV, twice time of potent of oral route is like the effect is 2 times potent more than oral. For the dosage, in the patient with normal renal function, the oral dose equivalence of furosemide related to other oral diuretic is as follows. 40 mg of furosemide is equal to 20 mg of torsemide and 1 mg of bumetanide. And furosemide oral tablet formulations are available in 20 mg, 40 mg, and 80 mg. Furosemide oral solution is available as 10 mg per ml or 8 mg per milliliter. Example, 40 mg furosemide in 5 ml of solution. Nursing consideration. This time, the nurse have to consider when before and after we give to the patient the furosemide. The first one is assess the blood pressure. It is for monitor for hypertension or hypotension, which can be influenced by the diuretic like furosemide. Furosemide can cause the blood pressure up and down. We need to monitor electrolytes, especially potassium, because it can cause potassium depletion, risking arrhythmias, and muscle weakness. We need to promote potassium-rich diet. Like we said, we need to monitor potassium, and also we need to promote potassium-rich diet because there will be so many loss of potassium in our body, and it can maintain normal muscle and heart function. The fourth one is we need to assess renal function to ensure the kidneys are functioning properly, or impaired function can affect the drug clearance. Number 5 is assess for dehydration and intake and output, because furosemide can cause dehydration and electrolyte imbalance. And we need to monitor daily weight of the patient to track fluid balance and detect early signs of fluid retention or loss.
Next, we have pregnancy safety index. So the study found that there was a slightly increased risk of congenital anomalies associated with maternal use of furosemide during pregnancy, particularly if furosemide was used in the first trimester. However, the absolute risk of congenital anomalies remained low, suggesting that the benefit of furosemide use may outweigh the risk in certain situations.
The last is special precaution. First, electrolyte imbalance. Furosemide can cause electrolyte imbalance such as depletion of potassium, magnesium, and sodium. Monitoring electrolyte level is crucial, and supplements may be needed. Second, dehydration. Furosemide is a diuretic, meaning it increases urine output. This can lead to dehydration. Adequate fluid intake is essential. Third, hearing loss. In rare cases, furosemide can cause temporary or permanent hearing loss, especially at high doses or with rapid administration. Fourth, gout. Furosemide can increase uric acid levels in the blood, potentially triggering gout attacks in susceptible individuals. Fifth, kidney function. Furosemide can worsen kidney function in some cases. Monitoring kidney function is important, especially in individuals with pre-existing kidney problems. 6. Allergy. People allergic to sulfonamide antibiotics may also be allergic to furosemide. Last, pregnancy and breastfeeding. Furosemide can be harmful to the developing fetus and should only be used in pregnancy when the potential benefit outweighs the risk. It can also pass into breast milk, so caution is advised while breastfeeding.